Good afternoon. I am Dr. C.C. Nair, a physician, Department of Internal Medicine, attached to Lilavati Hospital and Research Center. Today, our subject is how to keep ourselves fit and be happy. Of course, this is a big achievement if one remains fit and also free from almost all the diseases that one can think of by way of our own sustenance, our own efforts, our own lifestyles. The most common things which we are always worried in our common practice is hypertension, diabetes, and dyslipidemia. We have found that during the course of this recent COVID epidemic, all these elements had come into play in our fight against the COVID disease in patients who came with such comorbidities like hypertension, diabetes, and dyslipidemias, and also, of course, malignancies and other infections. So it is important for us to understand that hypertension is the first target that we should try to achieve. And of course, whenever a patient goes for a checkup and he finds that his blood pressure is high, we should always try and recheck at least once or twice before we confirm that he is really a hypertensive. Unless, of course, his first BP itself is very high, in which case you will have to control it as soon as possible. The second and third readings, if it remains high, then one should not shy away from medicines. One should try and control with whatever combinations one can have. Fortunately for us, there are plenty of excellent combinations that we have. Certain drugs which are useful in kidney and vascular problems can produce sometimes edema or swelling of the feet. But this is just a small effect of the medicine itself. And I think one should not try to avoid these medicines if it can be managed. If it becomes too troublesome, then of course we can change over to, fortunately, many other drugs that are now available in the armamentarium that we have. It's important that one should keep a check on the BP also. After having started the medicines, it's important that you can adopt a technique called ABPPM, which always checks blood pressure for the next 48 hours and from time to time tries to see what is your pressure levels, and then you can monitor it well and adjust the medicines accordingly to achieve your target. The target that we are hoping to achieve in most of the patients is a systolic blood pressure of 130 and a diastolic blood pressure of 80. If you can achieve this, nothing like it, because your target organs, which are the kidneys, the heart, the brain, and the blood vessels in the eyes, also are protected by way of control of blood pressure. It's important to understand that blood pressure is going to affect your blood vessels directly. In the internal lining of the blood vessels are damaged, which leads to many consequences like heart attacks, kidney failures, and also brain strokes. So it's important that BP should be controlled as quickly as possible in any of the patients which come to you. And there are fortunately many drugs which have very less side effects, which can be managed by your doctors. And on constant consultation, you find that these BP achievements can be made as per the guidelines that we have for target BP. The next most important fight against is diabetes. Our diabetes in our country, because of our own diet habits or our own probably lifestyles, has come in an epidemic form. And it's important to understand that diabetes can be controlled only by way of living lifestyles and also control of your sugars with the help of medicines and, if necessary, insulin. The target of diabetes is always a 3-monthly target of HbA1c of less than 7. If you can achieve that target by way of lifestyle modifications, by way of exercise, by way of trying to control your stress levels, getting adequate sleep and regular movements, exercises, and all these factors, if it is controlled, you will find that diabetes becomes easily manageable. And we get good results once you have it under control to below 7. So our aim is to try and prevent the damage that can happen to the target organs. And diabetes is one of the major factors which affect the target organs like kidney and the heart and brain and even the eyes, as you all know. And it's important that the medicines that you take for diabetes has to be properly titrated. Now we have a mechanism by which we have continuous monitoring of blood sugar, that is called CGM, continuous glucose monitoring. If that can be done for about 14 days, which is the target that is given, if it is achievable, if suppose your target the target blood sugar levels are in the range of maybe around below 180, the upper level, and below 120, the lower level, I think we would have achieved the diabetic control by far most efficiently. The third primary cause of problems that we face in our practice is fat in the blood vessels or in the blood itself. That is called lipids, and lipids again form a third wing of disease manifestation, a disease producing element. And in that, the most important thing that we should try to control is what is called as LDL molecule, low density lipoprotein molecule. It is not the total cholesterol alone, it is not the total triglycerides alone. What is important is non-HDL and LDL molecules, which should be in target. As per the guidelines of various scientific organizations, we find that the LDL should be below 80 in patients who don't have a heart complaint, and it should be below 50 in people who have got cardiac complaints. And the non-HDL levels should be below 130 in people who don't have any cardiac problems. If we can achieve this, then I think we would have achieved the control of the lipids, and therefore the consequences of lipids can be easily controlled. So friends, it's important that we try to achieve all these targets, whether it is blood pressure or diabetes or dyslipidemia, along with peaceful, good living, maybe little amount of meditation, little amount of yoga, or lifestyle modifications, which again reduces stress in most of the people. And stress is the main factor which affects all these three that we discussed about. So a good living means control of all this and probably a disease-free, comfortable living. Let's all strive to make that. Thank you so much.